Today, we're discussing the final results of the Phase 3 TALAPRO-2 trial for mCRPC patients presented by Dr. Neeraj Agarwal at ASCO GU 2025. TALAPRO-2 study is a combination of Talazoparib and Enzalutamide. This dual therapy targets both DNA repair mechanisms and the androgen receptor. The study reports a median overall survival of 45.8 months versus 37.0 months with placebo plus enzalutamide, which is one of the longest durations observed in Phase 3 trials for mCRPC to date. The subgroup analysis were observed across different subgroups, including those with or without homologous recombination repair, HRR gene alterations. This suggests a broad applicability of the treatment. Key secondary endpoints were also significantly improved with radiographic progression-free survival 33.1 versus 19.5 months. Median time to cytotoxic chemotherapy was not reached versus 56.1 months. Quality of life 41.5 versus 34.1 months to deterioration reinforced the efficacy. Adverse events. The study noted that the most common grade 3/4 of adverse events were anemia and neutropenia, with rates significantly higher in the treatment group 49.0% versus 4.5%. However, these were manageable with dose modifications with 65.3% interruption, 54.5% reduction, and 21.6% discontinuations. Anemia management 42.2% received transfusions, median 2 over 19.7 months. Dr. Neeraj Agarwal comments, these findings represent one of the longest median OS durations and largest improvements observed among randomized controlled Phase 3 trials in mCRPC conducted to date. His insights highlight the study's impact on the field of oncology. Dr. Edward E. Dorff adds, the fact that Talazoparib plus enzalutamide was associated with greater OS in the total study population strengthens the case for using this combination regimen. This expert opinion supports the potential shift in treatment standards. The study design included 805 unselected patients with newly diagnosed mCRPC and a subset of 399 patients with confirmed HRR gene alterations. The trial was stratified by HRR status and prior use of abiraterone or docetaxel to determine the synergistic effects of targeting DNA repair and the androgen receptor. Clinically, the combination of Talazoparib and enzalutamide has shown to improve overall survival in unselected mCRPC patients, suggesting a potential new standard of care for first-line treatment in this condition. Key takeaways include the survival benefit of the combination, its effectiveness across different patient subgroups, a manageable safety profile with primarily hematologic adverse events, and its potential to impact clinical practice as a new standard of care. However, a limitation noted is that the study might not fully represent patients who received intensified treatments or had different educational backgrounds, which could affect the generalizability of the results. Globally, the approach to mCRPC treatment is evolving, with this study potentially influencing guidelines and practices not just in the United States but worldwide. For patient selection, genetic testing is crucial to identify HRR mutations. Consideration must also be given to treatment goals, prior therapies, and the patient's ability to tolerate potential side effects like hematologic toxicities. For clinical practice, consider Talazoparib plus enzalutamide as a first-line treatment option for mCRPC. Close monitoring for hematologic toxicities is necessary. Educating patients on the benefits, risks, and monitoring requirements is vital. Subscribe here and go to oncologytube.com for more on this and many other cancer research topics.